Hi. So in going through the readings, there were several key risk factors that seem to have the greatest effect on individuals' likelihood to develop anxiety disorders at some throughout the course of their life. From the Corcoran and Walsh reading, some of the biological factors being um, heritability, which they labeled in the book as modest inheritability, because there's only 30 to 40% heritability from a parent with an anxiety disorder to their progeny, which I still find to be pretty significant. 30 to 40 is definitely not a small number. They also noted cigarette smoking, which makes sense to me. I that was definitely not something that I was expecting to be near sort of the top of what's considered to be risk factors for anxiety, but there are significant physical responses to. I wonder if this book was updated, if they would consider it any nicotine or specifically cigarette smoking, if there's a more agitating factor to cigarettes specifically. And they also noted that just female gender, identifying as female, is also a risk factor because women are just more likely to experience disordered anxiety, to the extent that would deserve diagnosis. There's some social factors as well. Being a member of the LGBTQ plus community adds stress and likelihood for disordered anxiety. Being of low socioeconomic status contributes as well, as well as the ethnic identity of being white, of being Caucasian, which I was also surprised about, but definitely helpful for me to know moving forward because that's not something that I would have considered or I would have assumed. And then lastly, there were some key psychological factors. One being low self esteem, which makes perfect sense for many of these internalizing anxiety disorders that we're talking about this week. A lot of that internalized panic. Anxiety in general is a very internalizing disorder, and so it makes sense to me that low self esteem, poor self worth would contribute to that. And then also emotional coping mechanisms or more escape avoidance coping mechanisms as well also contribute to a higher likelihood to develop an anxiety disorder at some point. And it's speaking on the different treatment availabilities for individuals with anxiety disorders. This is from both the Corcoran and Walsh readings as well as the Patterson readings. Um, medicinally speaking, um, antidepressants were actually some of the most common that are prescribed for anxiety disorders because they have some similar effects. So one being um, SSRIs are some of the more common prescribed medications for anxiety disorders. The problem with those is that they do tend to sometimes they can exacerbate symptoms, specifically the stimulation that a lot of individuals with disorders experience. At least at the very beginning of an SSRI cycle, that can tend to happen and can make it difficult for individuals who are prescribed it to stay on it for longer periods of time for them to become beneficial. Another are the entire category of benzodiazepines, typically in higher concentration, which can be difficult for a lot of individuals with anxiety disorders because a lot more I guess physically manifesting side effects for with benzodiazepines. Very common to experience dizziness and drowsiness, which can affect everybody's daily lives, to kind of constantly be going through having some of those physically energy draining side effects that a lot of people on benzodiazepines experience. And then with both SSRIs and benzodiazepines, there is a significant likelihood of chemical dependence, which is always a factor that we, as well as physicians, need to be considering when working with individuals and medication. Outside of specifically medical treatment, the absolute number one intervention is the most well documented, the most effective is CBT, is cognitive behavioral therapy strategies used in a lot of different ways. Two of kind of the most common and effective are cognitive restructuring, which is sort of when therapists work with individuals, train individuals to be able to do this on their own, but to catch maladaptive thought patterns when they happen, analyze them, challenge them, and then replace them with positive thought patterns. And that works with pretty much every anxiety disorder, panic disorders, agoraphobia, specific anxiety disorders. Very effective in all uh, every avenue. And the other being exposure. This is a lot more typical in maybe agoraphobia or other specific anxiety disorders, specific phobias, in which individuals are just slowly increasing their exposure to the anxiety-inducing stimuli, as it slowly reduces the amount of anxiety that it causes to a point where it's negligible and the individual can go about their lives without experiencing distress from that stimuli. Thank you.